Hello, welcome to my channel. If this is your first video, then I encourage you to go back and start at the beginning. Start with my channel introduction, and then definitely start with some of my videos from right after my surgery. This video is being made at 2 years post-surgery for me. So it's literally been like 2 years and a week since I had my pelvic floor surgery, prolapse repair, vaginal hysterectomy, all of those things. And I just really felt like I owed my viewers an update. I do get questions from you guys in my email and in comments where you're asking like, well, how are you doing now? We haven't heard from you in a while. I think the last video I made was at the 18-month mark. So I just felt like I should update and tell you the good, the bad, and the reality of where I'm at right now. So I wish I could tell you that everything is like amazing, I don't have any issues anymore, but that's just not the reality. I would say that I have no regrets about having my surgery and that I am definitely on a good side of recovery. I am not impacted by my surgery often, and that I am definitely able to live my normal life to the fullest without complaint. There are a couple of things that I'm experiencing, and one of those is I have talked about it in a couple other videos. I know I talked about it in my 18-month recovery video. I still continue to have some issues with pelvic floor tightness, pelvic floor tension, some spastic spots, some knots in my pelvic floor. And so I explained in a misconception video I made recently that there's a lot of confusion and women who think that pelvic floor physical therapy is only for when your pelvic floor is too loose, you're having issues with incontinence, whether that's fecal, urine, stress, whatever, or you've been told like you need to do a lot of Kegels. That's not the kind of therapy I'm doing now. Pre-surgery, that is what I needed. I needed to tighten my pelvic floor, and I did work with a couple of pelvic floor specialists back then to do a couple rounds of physical therapy, but ultimately they all told me what I already knew to be true, which was I was going to need surgery. Like no amount of Kegeling was going to fix my issues. My pelvic floor was just destroyed from my previous delivery and then my 2 very large babies. So now, 2 years post-surgery, I still have pain in my pelvic floor, which is not something I had pre-surgery. Like maybe, yes, during the prolapse time, yes. But before, like when I just had a weak pelvic floor and was peeing my pants all the time, it was not painful. Now, I frequently, unfortunately, have aching. Like my pelvic floor is just achy. It's like, I describe it as like a headache in my pelvic floor. It just hurts. It's like a dull pain. But sometimes it's also sharp. Sometimes I have a sharp pain and I have like pain that shoots down into like in my inner groin, into my right butt cheek, down my right leg, sometimes all the way to my toes. And what that is tightness in my pelvic floor that is pinching my pudendal nerve. So you have a lot of nerves in your pelvic floor, and one of them specifically that runs like down your legs, either side, is that pudendal nerve. And so if you have any spastic muscle tissue down there, anything like knots, then it can pinch those nerves, and that's exactly what's going on. So what that comes from is the surgery. My surgeon went in, he took my pelvic floor and he completely reinforced it with a bunch of stitches. Like he basically, as he put it, recreated me a pelvic floor. I didn't have one. Mine was so bad that he had to take my tissue down there and sew it all together. You know, if it was like this, he took it and made it like this. Okay, like it should be. Now, the issue with that is because it was done surgically and not by nature, obviously, then you've got some scar tissue. You've got spots where it was potentially sewn a little too tight, or, you know, it's just, instead of having the normal pelvic floor of a nearly 40-year-old, you know, mine is more like that of a 16-year-old, but it was surgically created. So there's just some spots that are too tight. So I do this pelvic floor therapy. I don't go into an office anymore and have a therapist do it because I've learned how to do the exercises myself or with the help of my husband. Yep. Never when he signed the paperwork or said his vows did he think he'd be helping his wife do pelvic floor physical therapy, but he's living the dream. Anyways, yeah, it's Not as glamorous or fun as people say. Oh, I bet he likes that. No, neither of us like it. He says his fingers cramp up. It's really uncomfortable and it's very painful for me. So basically what the therapist, or now my husband, do is when I get really tight down there, really sore, and I'm like, hubby, we need to do some pelvic floor therapy. I'm really uncomfortable. Like a lot of shooting pain, a lot of tightness, pressure, aching. He'll help me out. Basically what he does is he uses 1 or 2 of these fingers, usually just one. He has pretty large fingers, and he is feeling around inside my vagina down onto my pelvic floor, and he's feeling for knots. He says you can literally feel them, and my therapist describes it as like, so how your tissue in there typically feels like thawed out chicken, but if he hits a hard spot that feels like frozen chicken, that is a knot and that needs worked out. So sometimes just applying good pressure for 30 seconds, a minute, works out that knot. And then other times he kind of uses his fingers and massages it, and he will literally feel that knot loosen up. And then it's very painful for me though. I would be lying. Like there are times I'm like I am gripping his arm, or I'm gripping the side of the bed. Sometimes I hold my headboard when he does it because it is very uncomfortable. Like shooting pain, it causes shooting pains into your urethra as you do it. It is so insane how connected everything is down there. I had no idea. But you have nerves down there that shoot into everywhere. Down your leg, into your butt, feels like into your anus, like out your pee hole. And you hit them sometimes, and it is excruciating. But I also know that if he does not work those knots out, I'm going to continue to have pain. And after he's done a good session of therapy with me, I am much more relaxed. Just like the muscles in your neck or wherever else you carry your tension can tighten up when you're stressed, so does your pelvic floor. Like literally, I feel my pelvic floor tighten up after several days of like a really stressful couple days. So when my husband's not home, and I haven't been going to the therapist recently, I went for several months in a row until she had me understanding what I needed to do, my husband understanding what he needed to do. I also bought one of these. I talk about this in another video. I'll be sure to link it here too, but it's linked in that video. It's by a company called Intimate Rose. I bought it on Amazon. It is what we call a pelvic wand. The purpose of this is to do pelvic floor therapy on yourself. It's very, very hard to like reach in there with your fingers. You just can't get a good angle. This, you can use this end, you can use this end, and you can put it at all kinds of angles to hit those spots. Most of my tense spots, and it's the same ones over and over, they never like really go away. You just work out the tension, and then a few weeks later, you got to work out the tension again, maybe sometimes a few days later, but it's the same spots. All of mine are in my lower pelvic floor, like down, like go in and down. But some women, it could be somewhere else. It could be more to the side, more up. So anyway, this makes it possible to hit those spots. I bought the vibration version because it said that this is more like massage. If it's like vibrating, then it's like massaging. Honestly, I never use the vibration feature because it's uncomfortable. It's too strong. It's weird. It's already hard enough to hold this thing and apply pressure, and then you're holding it and it's vibrating. It just makes my hand vibrate. I do not recommend the vibration version. Buy the version that's just the plain old pelvic wand. But anyway, I don't like this thing and I don't use it very often. I much prefer to have my husband help me out, but in a pinch I will use this. So that's what that's for. Yeah. 2 years post-surgery, still needing pelvic floor therapy. It's just, I don't know. I don't know if it's something I'm going to live with forever, if it's ever going to get better. I don't know. So that's a bummer, but that's where I am. So maybe not, I'm confident not every woman would experience that. That is because I had my pelvic floor reconstructed. It's called something like a perineophy. I don't know. But that's what it was. So there's that. I also notice that if I have been potentially lifting more weight than I should in my workouts, doing too many sumo squats, like I try to not do the things that I'm never supposed to do, but sometimes I do a few and I'm really careful about it, or I don't use much weight, whatever. But if I have done too many, I feel it a little more than 2. So that's something to keep in mind, that you will feel things in your pelvic floor that you maybe never felt before, and you'll know that you've overdone it. Second remaining issue is I still just don't feel like myself. I've said in almost every recovery video I've done since 6 months or so that I feel like since my hysterectomy, even though I kept my ovaries, I feel like I am more tired. I feel like I've slowed down. I feel like I'm having some brain fog. I was having a lot more vaginal dryness, just irritable. Like I'm so freaking irritable. I don't know. And we keep checking my hormone levels, and as of 3-4 months ago, that's the last time I had it done, they're normal. Like my gynecologist is telling me they are within the normal medical range. Now, I've done a lot of my own research that says that normal medical range is not actually normal for every person, and that some women can feel just very slight variations in their hormones. I have done a lot of reading that says that even if you keep your ovaries, because they are no longer connected to anything and they don't have, or like, you know, they don't have a purpose. They're not connected to my fallopian tubes anymore because I don't have them. There's just less blood flow to them, and that basically you start to develop ovarian failure. Now, my blood tests are not showing that I am in ovarian failure. I don't know. Am I? Who knows? Is the test sensitive enough to tell that? I don't know. Is my issue related to the fact that I'm almost 40 and I'm, you know, potentially 5 to 10 years from menopause? I'm not sure. All I know is I don't feel the same. I don't feel like myself. So about 3 months ago, my gynecologist kind of reluctantly prescribed me 1 milligram of estradiol that I take once a day. So that was supposed to help replace any estrogen that I may be losing from ovarian failure, lack of my ovaries working like they should be. I don't feel better. The only thing that's maybe improved is I don't have as much vaginal dryness, but the mood changes, the things that feel like related to feelings, emotions, tiredness, energy level, I wouldn't really say that I'm feeling much improvement from that. So again, it could be completely unrelated and would be happening to me at almost 40 anyway. Or it could be that my ovaries were left behind, but they no longer have a purpose and they're shutting down. I don't really know. And I guess unless I'm willing to fight the system, say I need a more specific hormone test, or, you know, dig into it with a homeopathic doctor, I'm kind of just living with it. I guess the third thing worth discussing at the 2-year mark is that recently I've really kind of gone to a bad place emotionally, like dark place. Just kind of, I don't want to say I'm having like a mental breakdown or an emotional breakdown, but I've been in a pretty dark place the last few months, and it's not just related to the surgery. A lot of things happened to me in a 2-year time span. Right before I found out that I had the prolapses and needed the surgery, when my baby was 4 months old, my baby had been born with some pretty significant feeding and breathing issues. And I haven't talked about those in my other videos, maybe my channel intro, but he had tracheomalacia, which he, thank the Lord, grew out of. But in the beginning, he struggled to breathe very well. He had very, very loud breathing. He struggled to feed because his suck, swallow, breathe rhythm was very off. He would aspirate on his formula. Breastfeeding was out of the question. He would aspirate on his formula. The formula would come out of his nose. We had to do sideline feeding with him, which took away that whole ability to like cuddle my baby and snuggle him when I fed him. And then right as we came out of the woods from that, and just like we weren't afraid he was gonna like stop breathing in his sleep, and he was eating a little bit better, and we had found the right bottle and the right feeding specialist and all of that, I literally found out like right then I had to have surgery. I had surgery when he was 4 months old and was forced into a hysterectomy. I mean, not forced. I was told I didn't have to have one, but also that I'd be back on the operating table because it wasn't going to fix the prolapses like they needed to be. So although I wasn't 1,000% sure I was done having kids, I had to be. And that was emotionally taxing. My baby with all the issues was emotionally taxing. Not being able to hold him or carry him for 6 to 10 weeks was emotionally taxing. The strain it put on my marriage and my husband to do all of those things that I was doing around the house and with the kids for at least 6 weeks was taxing. I am no longer in this position, but at the time I was a high school administrator. That was very stressful. there were some really crazy things that happened in my career this last couple of years, just things that no one at their employer should have to face. Like, that is not, it's not a typical part of a job description at all. And that's why I'm taking a break from that profession or that specific job. But there's been a lot in 2 years. I'm not blaming it all on the surgery. However, I do think because I was so busy then and literally just in survival mode, that I did not have the time to process what was really happening to me and what I had been through, or to focus on me at all. Like, I know I'm saying, oh, my husband did all this stuff around the house because I couldn't, but I did not allow myself to just rest. I would lay on the couch like I was supposed to, like a good little patient, but I was so stressed and so sad and felt so guilty that I didn't take care of myself mentally or emotionally. Even if physically I was trying, I was not taking care of myself. I went back to work way too quick. I went back at the 3-week mark. You are recommended to take a full 6 weeks off. But I was a principal and school was starting up and I had already had a maternity leave and now a surgery leave, and I needed to get back to work, right? They needed me at work. So I went back to work, probably too soon. I'll never know the effects of that. Would my pelvic floor hurt like it did if I had recovered appropriately? Will I end up with a reprolapse because I didn't let myself fully heal? I don't know. I don't know any of those things. All I know is I pushed myself too hard, physically, emotionally, mentally, all of it. And there was a lot of pressure and stress and sadness. And I don't think my husband was sure he was done having kids, more so than me. But he knew that this is what I needed. This is what my body needed. So we went along with it. We did the hysterectomy. It seemed to make sense. Looking back on it now, I'm actually kind of thankful we did it, because I'm at the point, my last one is almost 2.5, and I would be thinking like, maybe it's time to have another baby, but our life is insane. I can't take care of another living thing. So I'm kind of glad I don't have to make that decision or send him off for a vasectomy or feel like it's our choice. Like, the choice was kind of taken from me, and that's okay because we don't need another kid around here. But it was really hard at the time, and I didn't heal from it. I didn't process it. So I say all this not to like sob about my story, but to say to you, like, God, give yourself some grace. If you're going into this surgery, please go into it knowing that you have to allow yourself to rest, and don't feel guilt over the fact that others need to take care of you or that you can't do all the things. And like, just be and give yourself grace, and don't beat yourself up, and rest. And whatever amount of time your doctor tells you to take off, please find a way to do it. I don't care if you need to put some debt on a credit card, you need to rob your savings a little bit, ask your family for money, whatever the case is, you need that recovery time, because not only physically, but mentally and emotionally, this is a hard surgery. It is really painful. It's really embarrassing. It puts you in places like, especially if you're like me with the packing and the huge hemorrhoids and some temporary fecal incontinence, and I had the suprapubic catheter that I was having to drain because I couldn't pee on my own. Like, it's a lot. It's a lot. Process that and just know that whatever you're feeling, all the feels are normal and okay, and get support. I kind of look back and think I should have had some counseling. Like, I should have gone through some therapy to help me process what I was going through. And maybe that sounds stupid to some. It probably would if you haven't been through this, especially with all the factors I had. 3 months postpartum finding this out, yeah, it's a lot. So those are the things. The hormone issues, not feeling like myself still, the pelvic floor pain and therapy, and just being frustrated. I'm still going through that, and the emotional aspect of things that I feel like is just kind of catching up with me. It's like my body is like, I'm done. Like, I'm exhausted and I need a break. I need to heal. I need to like process what I've been through, and I need a break. Like, it's almost like it's saying, I'm going to shut down. I'm giving you all the red lights. The red lights are going off. The sirens are blazing. You give me a break, or I'm going to shut down on you. And that's kind of where my body's been the last month or two. And so I won't go into detail, but we're making some changes in our life to allow me to just be and have that time that I need. So I encourage you to do the same. Aside from that, visually, everything appears to be good. Sex, Although slightly different, there are times where a certain angle or a deep penetration will feel uncomfortable, and then we just change it up a little bit. But honestly, I get a lot of questions about that, and sex is still enjoyable. Orgasm is not a problem, and it doesn't feel less or different. I know some women are like, oh gosh, I've heard after you have a hysterectomy. I have not experienced that, and I never had issues with orgasm before, and I don't have issues now. In the beginning, we definitely did use a little more lubricant. We don't need to do that anymore. So now when my pelvic floor is really sore, it's either off limits, or it's we got to do some therapy first, or it's slightly less enjoyable. But that is all related to my pelvic floor, not my vagina, not my hysterectomy, not my prolapse repair. It's the tight pelvic floor muscles and those like knots that are in there, pinching nerves. I had the suprapubic catheter. I have literally no scar from that. How? I don't know, but I have no scar. Down where my vagina was sewn on the outside, for about 9 months, I had like a weird, kind of like a pus-filled pocket, almost like a little cyst. And my gynecologist and I were like, do we drain it? Do we cut it off? Like, what do we do? And we decided to just wait, and it completely disappeared. Like, your body's amazing. I don't know if it was just external scar tissue or what, but it's gone. Completely gone. So again, time. Give yourself time. Give yourself grace. If you have something remaining at the 3-month mark, 6-month mark, give it time, okay? Most of it is going to go away on its own. So just have faith in that. Otherwise, I have no regrets. You know what I love? I don't pee my pants anymore. When I laugh, sneeze, cough, jump on a trampoline, like I can pretty much do anything that I wanted to do. I can have a bad allergy day and have a cold, and I'm not like standing there holding myself every time I have to sneeze. That is hands down the biggest relief. But, you know, my organs aren't falling out of me anymore either. So that's a good thing. And I can have a full bowel movement and not still feel like I need to poop afterwards. So overall, no regrets about having the surgery. And I think you would feel the same if you went through it. I'm just working on some lingering things. And you know, at almost 40, I probably would have some things I'd be dealing with no matter what. So I don't really blame it on this surgery necessarily. So I hope this helps. Please continue to like, subscribe. I'm definitely not trying to get famous off this channel. In fact, I don't really want everybody to know my business, but it does help other women find the content. And it's just really been heartwarming to me to see all of you commenting and reaching out on the email address and just telling me how much value you have found in this. And that means everything. That's the whole reason I did all of this. So thank you. Have a great day.